Welcome to the IMS Myofascial Pain webinar series. I am the Executive Director of the International Myopain Society, Ray Gleason, and I'm your moderator today. Today's topic is eliminating lower back pain, hands-on, and self-applied treatment techniques. All of the series presenters specialize in myofascial pain, and their presentations are meant to spread knowledge about this condition, the leading cause of chronic pain worldwide. The series will educate participants about myofascial pain diagnosis, treatment methodology, and scientific research. You will notice that there's a chat box on the screen, and during the presentation, or when you would like to, please ask questions. Just put them there, and at the end of the presentation, there'll be time for a Q&A. Today's speaker is Mary Biancalana. She holds a Bachelor of Science in Education, Physical Education from DePaul University, a Master's in Special Education from Northeastern Illinois, a Personal Trainer certification from the American Council on Exercise, and is board certified in trigger point therapy by Myofascial Trigger Point therapists. Her training and background in physical education, personal training, and trigger point massage therapy makes her one of the most well-rounded clinicians in pain management and massage therapy. She has over 30 years of experience in working with and teaching health-related subjects to thousands of people. Since 2001, her background in trigger point therapy advanced education has allowed her to teach practitioners pain relief techniques. She is currently the lead instructor for advanced trigger point seminars and has given over 500 successful education presentations and weekend workshops. Welcome, Mary.
Thanks, Ray. Nice to be here. Thank you so much. Wow, it certainly sounds like I've been busy in my couple of 21 or 22 years here in this wonderful field. It's an honor to be here with everyone today. Welcome. I can see by the taskbar we've got almost 100 practitioners joining us today from all over the world. So welcome to each one of you. And what I always say is each one of you is the world's leading expert in myofascial pain and dysfunction for those people that come to see you in your clinic or your space. So whatever skills you already bring to the table, on behalf of those many patients and clients you see, I'd like to say thank you. And we're all out there trying to change the world and eliminate the scourge of myofascial pain and bring people back to full, strong, pain-free function. So welcome to everyone. Welcome to our guests from all over the world. I see we have people here joining us from Italy, Israel, United States, and many other places. So welcome to everyone and thank you. So yes, it is an honor to be here, and I do have an interesting background being a person who came to this work through physical fitness and kinesiology. It's been really fascinating to learn and understand the many things that incorporate myofascial dysfunction. And most importantly, for the sake of this particular short little 45-minute webinar, we're going to be discussing manual therapy techniques that can be applied to eliminate low back pain. So if I were to ask all of you at home to raise your hand, how many people listening have ever had lower back pain in their life? And if I could see all of you, the chances that every one of you would be raising your hand, because if you look at the research data, just about every single vertical upright human is going to be having lower back pain at some point in their life. So we're going to be moving forward, joining this understanding of how myofascial pain and dysfunction can be giving us trouble when we have lower back pain. I'd also like to say thank you to my colleagues at the NAMTPT, National Association of Myofascial Trigger Point Therapists. It's an honor to be part of this group of fantastic practitioners. For my disclosure slide, I would like to disclose that I do have an ownership in a manual trigger point therapy training program. This business is registered in the United States. Other than that, I have no other conflict of interest. It's an honor to be, I guess if I were to disclose, I am on the board of directors for the IMS. It's been an honor to work together with Dr. Stecco, Dr. Frichten, Ray Gleason, Dr. Robert Gerwin, Dr. Renee Hartz, my colleague here, and Spring Fawcett, to be on the board of this wonderful organization. And we're out there also trying to bring the international community into awareness of the importance of understanding myofascial pain and dysfunction. So what is the purpose of this lecture? Well, I want to be able to showcase the value of hands-on myofascial trigger point therapy as a support to any medical practice wanting to aid in pain elimination. It's an honor to work here together with my medical director, Dr. Renee Hartz. I've run very many medical programs here in the United States. I've been the director of therapy for the Fibromyalgia Treatment Centers of America for 7 years. So that's been really wonderful. And so it's really been great to be able to be participating with these other colleagues of mine. I want to highlight the unique treatment options for some of the overlooked muscles that contribute to lower back pain. 2 muscles we're going to be going over today. So if you're joining from home and you want to grab your Travell and Simons book, or you want to grab an anatomy book, I'd like you to flag the chapter for abdominal obliques and rectus abdominis. Then we're also going to be going over the gluteus medius. I really feel that the gluteus medius is a very, very strongly overlooked muscle that is a strong contributor to low back pain. Thirdly, I want to help you, the practitioners, maybe the MD, DO, physiotherapist, physical therapist, massage therapist, myotherapist, and trigger point therapist. I want to help you be more focused on assessing and treating myofascial trigger points. And you're going to see here, guys, MTRPs is part of the abbreviation for that, myofascial trigger points. I want to show you advanced manual therapy techniques that you can take home to your practice and allow you to get the best patient outcomes you can. And then lastly, you're going to see a demonstration of self-care resources that are available to the chronic pain patient, because we find that about 80% of their ability to get better is for them to be empowered to take activities home and be able to perform self-trigger point pressure release. And we're going to be seeing my daughter Anne-Marie and just one of about the 200 YouTube videos that I have available for all of you that are absolutely free. So we'll be answering some key questions today, and you guys should be able to be yelling the answer at home, yes or no. Are you ready? Can myofascial trigger points in muscles and fascia contribute to lower back pain? Yes or no? Okay, I heard you say yes. Can we use myofascial trigger point therapy techniques in the muscles that can cause and perpetuate lower back pain? Yes or no? Can knowing the above prevent future low back pain episodes? And can self-care techniques be applied to the same muscles to aid in overall health, pain elimination, and to reduce potential injury or activation in the future? The answer to all those questions, as I heard you say, is yes. We can eliminate lower back pain caused by trigger points. And interestingly, these illustrations are illustrations of me, yours truly, with my spaghetti hair there. These are some illustrations from my book, Trigger Point Therapy for Low Back Pain, and we'll be talking about that a little later. So, as I've already said, all of us have suffered with lower back pain at some point in our lives. We all need to do regular exercise, have a great diet, drink plenty of water, and be ready to bend and stretch and rotate and twist and be able to do all of these things at all times in our life. We all know that low back pain is a bummer. We all should have full pain-free range of motion. We should be able to do once a year tasks like painting our house, special projects, a new activity. However, as Dr. Travell has said, she knows that new and unaccustomed activities are the number one reason why we all get myofascial dysfunction or activation of those latent trigger points. So this can, once we get this pain, it can lead to fear, pain or fear of the pain, changes in activities, changes in posture, lots of over-the-counter drugs, testing procedures, etc. And here's a little stats. At any given moment, 31 million Americans are experiencing lower back pain. Oh my gosh, that's an amazing statistics. Americans, and forgive me, I just did research for Americans, but I know worldwide the numbers would be even more tremendous. Americans spend at least $50 billion per year on treating their back pain. And that's just for the more easily identifiable costs. And per the researcher, doesn't include things like time off work, reduced productivity. Experts estimate that as many as 80% of the world population will experience a back pain at some time in our life. And of course, just in the US, billions of dollars are spent for medical interventions, including 12 to 36 visits for physical therapy, MRIs, x-rays, injections, drugs and medicines, days off work. Well, we say, go the cheap and easy route first. Use the trigger point therapy model or the myofascial or fascial manipulation model. Integrate the whole person. Eliminate perpetuating factors like sleep posture, work posture, hunched over posture, hyperpronation of the feet, small hemipelvis, high caffeine diet. We want to eliminate those perpetuating factors, brought to us again as a long, long list by Travell and Simons, and then we go forward and we treat the muscles. And there it is. This is the 2-volume set brought to us by Janet G. Travell and David G. Simons, and many, many, many other contributing authors, including Robert Gerwin, Lois Chapman Simons, and many, many other contributors. Thank you. These books changed the world of medicine. Then we have to give amazing credit to Bonnie Pruden. She worked together with Dr. Travell, Dr. Tivy, and she created myotherapy, which is the hands-on manual therapy that many of us use today. Many thanks need to go out to Bonnie Pruden, and it's been an honor to meet her in my lifetime, and she told me to keep up the great work. Many thanks also need to go out to Claire Davies, and then later on, his daughter Amber Davies, my friend and colleague and NAMTPT member. Amber Davies, through Claire Davies, brought self-applied trigger point pressure release to the layperson. And unbeknownst to all of us, Claire did so much work with a simple tennis ball, lacrosse ball, to bring applied trigger point therapy techniques to the layperson. But then moving forward, we have to thank other inventors like Spring Fawcett, who brings us the Tiger Tail family of self-applied self-care tools, the Bun Gladiow, Renee Gladiow family from Pressure Positive, who bring us all kinds of self-applied tools, and even Fitball, who many of these products I use, and you'll see them highlighted in the videos. And then there's my book, published in 2010. What an honor to continue the Trigger Point legacy brought to us by Claire Davies and Amber Davies. And you can find this book used online. It's not published anymore, but there's plenty of copies out there. So what are the muscles that when harboring trigger points can cause low back pain? Again, thanks to Travell and Simons, we have lots of muscles. Iliopsoas, longissimus thoracis, iliocostalis lumborum, iliocostalis thoracis, the lumbar multifidi, rectus abdominis, glute med, serratus posterior inferior, quadratus lumborum, the abdominal obliques. Thank you to Travell and Simons for that list of muscles. All of these muscles can contribute biomechanically and by referred pain patterns to the patient or client that has low back pain. But my focus, as you can see from behind my screen here, if you can see me, I am a myofascial trigger point therapist by training. I am a physical education person by training. I'm a kinesiology minor by university studies. And so I focus on the muscles. I'm also a fitness trainer, certified personal trainer by American Council on Exercise. So I focus on the muscular and functional and fascial focus because I also use a lot of fascial studies. I am so grateful to Robert Schleip, Leon Chatow, the Stecco family, all members of the fascial focus, Jean-Claude Guimberteau. I've studied through the fascial, the World Congress on Fascia. So remember, you can see here on the screen, guys, myofascial trigger point therapy. Myo means muscle, and there is our fascial component in the name. We've had the word myofascial in our name for well over 36 years in the National Association of Myofascial Trigger Point Therapists. So we have a complete and comprehensive system of myofascial evaluation. That's myo, muscle, and fascia. So evaluation, manually applied manual therapy techniques to relieve soft tissue pain in the muscles, tendon, and fascia, and to return our individuals to full function. So here it is. That's our first muscle for today. Take a look. Dr. Travell called the gluteus medius the lumbago muscle, which means low back pain. It's another fancy name for low back pain. I believe it is an often overlooked source of low back pain. And in this particular course, we're going to be looking at this TP number 1. Look at that trigger point just along the iliac rim and just inferior to the iliac rim. The black X indicates the most probable location of the trigger points, and the red stippling indicates the very easily reproducive referred pain pattern. And thank you to Fernandez de las Peñas and Jan Damerholt for their Delphi study, which did come up to a consensus agreement that we believe that these referred patterns can refer many types of sensation, not just pain. So that could indicate heaviness, achiness, weakness, dysfunction in the muscles, tingling, buzzing. I've been teaching since 2001 the very fact that indeed, yes, there is referred sensation caused by trigger points. So now we just have a collaborative paper to let us know what pretty much I've been teaching all along, but thank you to them. So as we move forward, we're going to be watching a 3-minute video. This would have been a live demonstration, which because I teach live my 14-hour training programs, but with these worldwide broadcasts, we don't want to risk anything funny going wrong. So I've got a video of what I would be teaching you live. So it'll be about a 3-minute video, but I want you to keep these points in mind. Number 1, for trigger point therapy, it's best to treat the intended muscle on a fully supported but most possibly stretched position. In this video, you're going to see the therapist, which is me, with the right leg in a abducted position, which I think is my husband, Mike. So thank you for being a good sport, Mike, for many of my videos. We're adducted to about 25 degrees because we know that the gluteus medius is a active participant in what motion? Abduction or adduction? Abduction. I heard you guys saying that. We want to maintain constant communication with the patient. We want the client to be in a neutral or stacked position. You're going to see me ask Mike to stack his shoulders and stack the hips. We want to confirm the application of the correct muscle So we're always going to do a contract relax. And again, thank you to my friend and colleague, Dr. Julie Zuliger from University of Wisconsin. Dr. Zuliger has really advanced the ability to do contract relax and really honed in my skills. So I always do a contract relax to confirm the muscle that we want to treat. The manual therapist should maintain ergonomic neutral. Watch me in the video and you'll see I want to maintain upright position. We want to find bony landmarks. So you're gonna see me find the iliac crest. Patient education is empowering. So I might have Mike touching and palpating the muscle. And then we follow the illustrations provided by Travell and Simons to make sure we're looking for the trigger point we want. And then replication of their pain complaint. And I'm going to be asking Mike in the video, what is the number of discomfort I'm causing you? Because we really only want to stay at a discomfort level of about below a 6 on the analog universal pain scale of 1 to 10. At 9, you have to call 911 and initiate EMS. 8, they're openly crying and cannot stop crying. 7, they're almost crying. So we stay below that number into a 6. So I will thank Nicola. We're going to play the first video, manual therapy techniques for trigger points caused by gluteus medius. Hi everybody, Mary Biancalana here from Muscle Health LLC, continuing education provider, working under the Advanced Trigger Point seminars. This supplemental video is going to be supporting our low back, abdominal, and hip pain class. And in this first video, we're going to be going over 3 muscles, a couple of muscles, glute medius minimus. We're going to be going over the piriformis and the go-go's and the tensor fasciae lata. So you'll see the patient is in the sideline position. So what I'm going to do is I'm going to have you bring your leg back there, sir. Drop that down. We're also going to try to get the client into a stacked and vertical position. In this position, you can see that their pelvis is tipped posterior. So I'm going to say, raise your bottom hip up and bring your glutes back toward me. So I kind of grab the waistband, adjust, and pull back from there. So in this way, we'd like to get our clients used to sleeping in a more neutral position. And you can see I've brought the leg back into this sideline position, and I've got a corn husk pillow here from Mother Earth supporting the leg. So I want to again make sure that they're stacked. To find the gluteus medius trigger points, we want to find the iliac crest. We're going to follow that iliac rim all the way to the front or anterior ASIS where it begins to dip anterior in the front. We're going to start about 3 fingers posterior of that ASIS. I'm going to lean forward and tip my client forward. If you are a male or you do not want to lean against your clients, you can use a barrier and say, I'm going to be leaning this against your pelvis and against your glutes because I need to lean my hip against your hip. I'm leaning my front against them, but you kind of get the idea. Great job. I'm going to lean you forward. Then from here, I'm going to go about 2 to 3 fingers below the iliac crest and begin with the patient in the sideline, slightly adducted position. I'm going to work my way back right along that iliac crest. Again, we want to follow the guidelines that were given in the basic handout as to how long do you hold, how hard do you press. All of those elements are covered in the other handout. Now, if you're not sure if you're on the gluteus medius, here's where the contract relax portion comes in. Can you raise your leg up in space there? Hold it up for me. Good. Drop down. Now let's put our hand over here so you can feel your own muscle contracting. Get your thumb right on there. Good. Okay, raise the leg up. Can you feel that muscle contracting? Drop it down. Yes, I can too. Raise it up again and drop it down. Thanks. So that contract relax really helps me make sure that I know that I'm on the right muscle fibers. So for gluteus medius, I'm going to, again, if I want to get the anterior gluteus medius fibers, pick your leg up, sir, bring the leg back, drop down. I'm going to make a pull back anchor here, and then I'm going to be pressing in and forward. What's the number of discomfort I'm causing you?
4.
4 out of a scale of 1 to 10. 6 is our limit. Any shadowing, traveling, or spreading of sensation anywhere? Just radiating out from where I'm pressing. So I'm repeating. So as I work my way back, I want to get to the posterior glute medius. So then we're going to bring the leg anterior. Bring your leg forward. Keep the knee straight and let it drop in that direction. Good. So then I'm going to continue to palpate the iliac crest, press down and in, or press forward so I can get the posterior gluteus medius fibers. Okay, so I guess we just, we did test the sound, and thank you, Nicola, for everything. We did have one person say that it seemed a little quiet. We did test everything. I will tell you that many of these videos are free on my YouTube channel, and I could also work with the IMS on providing many of these educational videos to you guys in the future. So I apologize. Just one person said they thought it was a little quiet, but when we practiced and we had it here, it seemed pretty loud. So check the volume on your machines at home, everyone. So as you could see, that was just one portion of a 7 to 10 step comprehensive myofascial trigger point therapy model. I just jumped right on to the treatment example, but I'm going to be going over what are the 7 steps in the entire model in a moment. So we say it's not just about the trigger points, but we assess the whole person, their muscle function, and what they want to achieve when they want to achieve it. So for example, if that person in the video was a tennis player, Mike, are you a tennis player? In another life, no. And so let's say every time he stepped forward and twisted and wanted to hit the ball with the racket, he got low back pain. Given that I would assess the function of the activity that he wants to do, and then target the muscles that are actively engaged during the action. Then we would also target the muscles that either need to be eccentrically loaded during the power phase of the action or eccentrically loaded during the deceleration phase. So for those of you that are sports focused, there's my sports performance self coming out. When I work with Chicago Bears or Chicago Blackhawks or D1 through D3 division collegiate athletes, we have to specifically target the function of the muscles that are the ones that we want to treat. So for those of you that are listening, here's a clinical pearl for you to take home. Think about whether it's a mom, a grandmom, an athlete, a runner, a soccer player. Think about the muscles that are needed to be used during the action at which they get pain. Then go backwards, write that list down, and apply your manual therapy assessment, palpatory assessment, and then clinical reasoning to those muscles. And then in your clinic, have them replicate the motion that's the offending motion. So now you see the whole model rather than the one little piece that I just showed you. Got it? So there it is. So we also include many other techniques, including PNF, proprioceptive neuromuscular facilitation, fascial manipulation, reciprocal inhibition, cold laser, percussion, laser, heat, frequency-specific microcurrent, specific frequencies like a rebuilder machine. We have other modalities that based on your own certification you could use, but those are just some of the modalities that we use here. So again, we always want trigger point therapy to be applied at home. We want the client to be able to use various tools. We use gravity and stretch. Oh, so the reason why this slide came up is the next video is going to be the next step. So in clinic, our people get manual therapy from all of us trigger point therapists here. And then we give them education to take home to apply the self-care, which includes trigger point pressure release, range of motion, and stretching within that self-care. So again, as we see here, we want to use gravity and the stretch of gravity to apply the force. So in other words, 90% of the time, we don't want the client to take their own hand, reach over and try to treat their own muscle, because then we've got muscle action, some muscles on the short and some muscles on the long, applying the pressure. So we want gravity. So we are so grateful to these various tools. You can go from using a tennis ball to other excellent balls on a rope, balls on a string. As I said, there's lots of other options. We want to combine this self-compression with full range of motion activities, reaching down, then up, all the way down, then up. We want to reinforce their fascial length and fascial wellness. I'm so grateful to Robert Schleip and his wonderful book called Fascial Fitness. I prepared a presentation. I've already presented on that. It's a great book. If you guys don't have it, you should get it. It's wonderful. So we incorporate all these wonderful fascial stretching concepts along with the muscles. We want to reinforce these changes. We want to improve function and restore strength. Because what do we know? Trigger points, muscles with trigger points can have what, guys? You should be yelling it out at home. Muscles with trigger points not only have referred sensation and autonomic disturbances, but we have a reduction in strength, reduction in power, reduction in endurance, reduction in accuracy. So what does that mean for some of you across the world who are working with world-class athletes? If you don't target their myofascial problems, do you want $1 million athlete to go from 100 miles an hour to be able to throw a pitch to only 89 miles an hour? That would be very bad for their professional life, right? So understanding the myofascial component and then treating those trigger points that are force producers as well as decelerators, then you get amazing results. That's why I've been able to work in this field for 21 years and have great success. And then lastly, we want to empower the patient with these self-care compression. So next you're going to see my daughter, Ana Maria Biancalana, demonstrating the 5-inch fit ball, but we could also use a 5-inch tiger ball. You could use a woman's softball. You can use many other products that you might have at home, but we want you to watch how she's going to be applying this trigger point pressure release to the gluteus medius. And then Nicola, I've got one question. Does my picture of me disappear when the video is running? Because I know an image is going to appear showing the gluteus medius, and I hope that the participants can see it. Okay, everyone. Thank you, Nicola. We're going to see the next video, number 2. Hi, everyone. Mary Biancalana here with a helpful video as a supplement to our Massage Magazine print article. So we're going to be treating the gluteus medius muscle using a fit ball body therapy ball. And in this case, the ball that you can see, you want to give me that ball, Anne-Marie, is a 5-inch fit ball. And we do use these for body therapy or myofascial trigger point release. Okay, we're going to take that ball, we're going to put it under that right glute. And to really get that uppermost gluteus medius, Anne-Marie is going to lean down and in. And again, why are we doing the gluteus medius when this article was for massage therapists preventing low back pain? Well, the gluteus medius, when harboring trigger points, refers pain, a dull pain and ache right along the iliac crest and even into the center of the low back on the SI joint area. So that's a great way to target that upper rim. Cross this leg over that leg. Now we're really getting some rotation into that femoral head and into the hip there. So that's more targeted treatment. You can hold each spot 3 to 4 breaths, hold still. Exhale, try to keep that side loose, and you're looking for any exquisitely painful or discomforting spots. Take the ball out. After you've done that for 6 or 7 minutes, we're going to now go ahead and do a stretch. So cross this leg over that one. This leg stays straight. This one crosses over. Grab that arm and lean up and in, keep the torso up and straight. So now we're getting a really good stretch for those deep lateral rotators as well as the fibers of the gluteus medius there. Of course, minimus and piriformis. So this was our helpful hint on the compression and the stretch of the gluteus medius to help eliminate low back pain for massage therapists. Brought to you by Mary Biancalana, Advanced Trigger Point Seminars, and the Chicago Center for Myofascial Pain Relief. All right, so there you go. So that is just one example of self-applied myofascial trigger point pressure release. Again, resources available to you guys on the YouTube channel. So my YouTube channel is under the name of my clinic, which is the Chicago Center for Myofascial Pain Relief. You are welcome to use these videos for your clients and patients. They're free educational resources. And yes, thank you. So we've got loss of strength, 19 ischemic compression. Right, of course. So yes, so thank you for comments. We don't use the word ischemic compression. Thanks to Dr. Simons in his most recent paper, it's now called trigger point pressure release. But thank you for your comments, Janet, Rhonda. And there are actually, can I have the JBMT? There are now thousands and thousands and thousands and thousands of current research papers showing biochemical, mechanical, and functional changes in muscles. Many, many, many thanks to the JBMT. This is a legacy of Leon Chatow. It's an amazing journal for research and study. And so we've got Jay Shah, we've got lots of other researchers who are doing current research in function in muscles. So one of the biggest perpetuating factors in low back pain, of course, is poor seated posture. I don't even need to tell you, I've seen pictures of clients that are coming to see me of their workstation at home that includes sitting at their dining room table or sitting at the corner of their kitchen table. Certainly during this pandemic, it was very difficult. People and children and families were all working at home, but we can't stress enough the idea that perpetuating factors need to be addressed. So as I said previously, this little mini lecture just jumped right into one little piece, but the full treatment protocol for the manual myofascial trigger point therapy is we take a full and detailed history. We do range of motion assessment. We treat and use trigger point pressure release techniques and all of those other modality techniques that are in our toolboxes, including contract, hold, relax. We use self-care compression education. We then encourage full range of motion here in the clinic actively during the session. And then we modify people's training load and their function. And then we do a post-treatment assessment and analog pain scale. So now we're going to do the third and final video, then we'll bring ourselves to closing. And this is an example of a sideline treatment to treat the abdominals to eliminate low back pain that is caused by the referred sensation. I think this is unique and advanced. This is just indicative of some of the really advanced and highly functional training techniques that I teach. And it's been really successful. I think laying people on their back leaves the client and patient a little vulnerable, whereas treating sideline on the body support cushion really allows us a better function there. And my other question is, I may be, Nicola, shortening the video. It's about 4.5 minutes long. We don't need to listen to the whole thing, but we're going to be maybe having Nicola move forward to about the 2-minute mark. Maybe I'll ask you to do that, but I'll leave my microphone on and be interjecting. So thank you for that. And let's watch sideline treatment of abdominals because we know they can refer pain into the low back. Down and anterior. So I'm pressing toward the midline. And you can see I'm leaning over. This way it affords me good ergonomics of my shoulder. You can see that my shoulder is right above the olecranon of my radius and ulna there, so, and the humerus. So we're going to be pressing there and through. To get at the other portions, we're going to be creating a series of directional. So this is for the oblique abdominals, and we're going to probably even follow the inguinal line all the way down in toward the pubic symphysis. For the rectus abdominis, you'll see by the illustrations that we'll be using in class, these really should be called the 12-pack abs, not the 6-pack abs. And there are a number of areas. Rectus abdominis is going to be about, on a person this size, 4 to 5 inches right down the midline, all the way to the pubic symphysis. So again, if we're not sure if we're on it, rotate yourself upward, try to sit upward. Can you feel that contracting? So I've already located that. I'm going to lean over and press in and back. Not a lot of effort for me because my shoulder affords me the ability to press around and in. I keep my face away from the client. I'm going to move to another location. Give me a number. 4. So again, that's rectus abdominis, and we would continue all the way down with the hip in extension. We could even add a little bit more tension for a short while, allow the torso and the arm to go up in extension. That would pull the ribs up and give us a little more effort in the external obliques. Okay, so that was just a short example. Thank you, Nicola, for scooching ahead. In the beginning of the video, I talked about the abdominal obliques, and I don't think there's any question for all of us that are living and working that chronic scrunched over sitting posture is probably one of the most profound perpetuating factors in chronic low back pain from an ergonomic perspective, from a fascial perspective, and from a functional perspective. So there's no question it's really important. So I'm just going to go to my closing slides when they magically appear on the screen. There you go. Thank you. So there, of course, everyone, you all know there are many, many other muscles that cause low back pain. Oh, and I wanted to add what an honor it was to have had phone conversations with Dr. Simons prior to his passing away when we were in revisions for the publication of our book on lower back pain. And one of the things that was interesting that he said in this phone conversation was that he does admit that on the illustration of the rectus abdominis, he and Dr. Travell would have put X marks in every single multiple integrated section in the rectus abdominis. So you know there are many tendinous inscriptions through what we call the 12-pack abs, not the 6-pack abs in the rectus. And so he does indicate that there would be many more trigger point possibilities, and that he said that's the job of the myotherapist to just keep palpating and treating. And even though in the example video, I was in the upper rectus abdominis, you did see in the illustration, it's the lowermost pubic symphysis or inferiormost attachments that can refer to lower back pain. And in the training program, we certainly go over that. But here's an illustration from my book showing the possible treatment locations for the paraspinals. Again, thanks to Clay and Pounds for their illustration of the longissimus thoracis. We don't want to eliminate these guys or forget about them, but we just don't have time in a 45-minute lecture. My training classes are 14 hours long, 2 7-hour days on the weekends. So dynamic movement is important for muscle and fascial health. No question about it. These are just some illustrations of the suggestions for range of motion and exercise I provide in the training program. And this is an example of educational materials. So we would give a handout to the clients or patients to be very aware of sitting posture, have something to support the elbow and the feet. And of course, I don't need to tell you, but the clients really get a kick out of seeing these icky postures. And I'll say, this is a perpetuating factor in your lower back pain. So believe it or not, you probably are sitting in this way at home. Then we also want to make sure we're correcting sleep posture. And in my book, I've got a whole chapter 17 and lots of pictures on poor sleep posture. The worst one is sleeping on the stomach. And then these are going to be corrections for sleep posture to ensure that we have good positioning of the low back and the muscles of the torso for sleep. So in conclusion, how about that? We made it through 45 minutes together. in conclusion, we all know, trigger points have a huge impact on muscle function. Everyone, every human is susceptible to myofascial dysfunction and impairments in our everyday life. Practitioner, raise your hand because that's you guys at home. Practitioner provided treatment techniques and patient self-care techniques are critical to eliminating the trigger points. And one of the things that I personally didn't introduce in my lecture, but my friend and colleague and medical director sitting right next to me, Dr. Renee Hartz, will be talking about in our next lecture, which will be October in this seminar series, is we'll be providing a series of videos that will show the combination of therapies that we provide, which is the manual therapy together with doctor or clinician provided trigger point injections. And it's an amazing combination modality. We've got success here in our clinic that is so rewarding and so fulfilling. So please look forward to that October series with Dr. Renee Hartz. I just didn't discuss that in my program because the trigger point injections are beyond my scope of practice, but it's so great to work with clinicians who are able to provide that. And then of course we look at the full Trevelyan-Simons protocol. So in this lecture, we showed the value of hands-on manual therapy, myofascial trigger point therapy to support any medical practice, occupational therapy, physical therapy, physiotherapy, osteopathic medicine. Our friend and colleague, Dr. Mazzira, has been an active part in this manual therapy. We've shown that there are unique treatment options for some overlooked muscles, including rectus abdominis, glute med, and that the practitioner should be more focused on assessing and treating these trigger points. And if you don't think you are focused enough, there are many excellent training programs out there to support you, and that advanced trigger point therapy techniques are possible to produce good patient outcomes, and that we gave you examples of self-care resources, and I told you there are a dozen more. So thank you. Go back and practice these techniques in your own clinic. My resource is chicagotriggerpointcenter.com. You can consider getting training in these important techniques. I do CE training, or you could host a workshop wherever you live. These are some great books. You can buy them at amazon.com. And there's the end of my programming. These are both the website resources. chicagotriggerpointseminars.com is available to you. So Ray, thank you. Nicola, thank you. Any questions from our esteemed participants today?
Hello, this is Ray again, and please write your questions in the box there, and we will be getting those over to Mary so that she can answer those for you. Mary, I do have a question. I was diagnosed when I was really young with, they called it lower back pain syndrome. And I'm talking about 11 years old. I mean, a long time ago. And it eventually went away after my first pregnancy, which I think is really weird. But anyway, my question is, I think that was caused from an injury. So you didn't talk a lot about if that's one of the things that you ask your patients, if they've had an injury to any of those areas.
Sure, of course. Part of our intake and history, we have a 7-page history and intake form that people fill out. And yes, even in my own private practice and here, certainly with our medical director, we ask past car accidents, injuries, any disc pathology, low back pain, facet hypertrophy. You know, we look for all kinds of other more complex things. But again, I'm not addressing those in this particular webinar. But remember, many people call an injury really a severe or acute activation of the myofascial trigger points in their muscles. So I would say it's almost hard to tell, but yes, we do. Any other questions?
There is a comment here. And I thought maybe this would be something you might address.
I read the comment already. Yes, thank you.
Okay.
About Janet and David.
Yeah, do you want to
I
address
did.
that?
I addressed it in the lecture. Thank you.
And you did that already. Okay. All right.
Yeah.
And I
So
know
the
that
book name, so the name of my book is Trigger Point Therapy for Low Back Pain. The
okay.
other great resource is the book by Amber Davies, Claire Davies. I only recommend you get the 3rd edition of the Trigger Point Therapy Workbook. It sold millions of copies and it is published in, I think, about 52 languages. Trigger Point Therapy Workbook.
And then I had another question, because remember, I'm a layperson and I don't do any of the therapies or anything, but I, of course, know a lot about myofascial pain and about how to treat it in some respects. One of the things I was wondering about is, do you ever train a partner with
Yes, of
somebody?
course. As a matter of
Okay.
fact, yes, I just had somebody yesterday. So in clinic, we will teach a partner how to treat the other partner's problems. Because honestly, myofascial trigger point therapy is relatively easy. And yes, my colleagues that are cringing, there are very many dangerous conditions that we would not be treating through active cancer, open skin wounds, any swelling or redness, and all of those things are addressed in my training program. But yes, we do teach a partner. So I would say this, that for those of you that are listening, it's been a wonderful 21 years of me working in this field. And the trigger point therapy, while I'm a licensed massage therapist, I don't do massage therapy. I only have a clinic that focuses on myofascial trigger point therapy, period, which has that manual therapy, the trigger point therapy component. So the training that I teach really affords the clinician a whole series of fascinating and new ways to look at issues. I had a handout on the table there, Mike. And what is also pretty cool is I've been able to travel the world through the IMS. I was able to go, I had that QR code. Oh, here it is. Been able to travel the world. So Ray and I and Dr. Frickton and Dr. Sharon and Dr. Gerwin and Jan Damerholt traveled to Bangalore, India. Oh, and Spring Fawcett from Tiger Tail, who's on the call with us today. We're board members. We were able to travel to India and teach all the way across the globe. And what I've done is created these educational materials that make it very easy for anyone across the world to simply click on a QR code and have access to the educational materials. And so it's been really great. I do teach these webinars live, 7 hours at a crack, and all of these resources are available to all clinicians. We've had doctors take some training, occupational therapists, dentists. So that's really been fun. So it's been an honor to work with clinicians really from all over the country, and through the NAMTPT and the National Association of Myofascial Trigger Point Therapists. We're so happy, Ray, to be connected with the IMS, and we're happy to be hosting some of the events that this wonderful group, the International Myopain Society, our current president, Dr. Antonio Stecco, and other board members are producing these excellent educational materials. So I encourage everybody to stay tuned. We're getting lots more materials online. I feel that we are really bringing the international community together to see that these myofascial and fascial therapy modalities are important. And we thank all of you clinicians who are here with us. And I personally, and I know Dr. Hart's our medical director here with us today, we'd encourage all of you to become a member of the IMS. And we have a partner relationship with which organization, Ray?
With the American Academy of Pain Medicine.
Mm-hmm.
We're building that, and that will be hopefully will be launched here before too long. We've got some wonderful things for our members, and actually for the AAPM members. I think that it's going to be a really nice combination.
Wonderful. So really, there is a national community starting up again in the fall. I do a whole series of free lunch and learn webinars They're kind of fun. We keep them light. We pick one specific muscle. It's also been an honor to work with Virginia Street, who is the daughter of Janet Travell. It's also been an honor to work with Janet Travell Street, who is the granddaughter of Dr. Travell. I also want to let everybody know that the NAMTPT is having a 2-day online world broadcast webinar, and we're honored to have many of the IMS presenters to be with us. Dr. Stecco will be giving us a presentation, Dr. Julie Zuliger, Dr. Renee Hartz, Dr. Jim Frickton will be presenting for us. We couldn't get Jay Shah because Dr. Jay Shah, he was busy, but that program is going to be coming up in October, and it's a 2-day online live interactive webinar broadcast conference. And then we're looking forward to the 2022 Padua, Italy event that's going to be provided by the IMS. The Stecco Fascia Manipulation Foundation is going to be a main sponsor of that. And grazie, Signor and Dr. Stecco. We're looking forward to being in Italy, Padua, Italy, in June of 2022.
Yeah, and for those of you, if you want more information, please go to the International Myopain Society website, which is just www.myopain.org, and you will be updated as our plans continue. If we don't have any other questions, it's time to close, and we hope that all of you will join us next month on September 23rd for our next webinar. And we appreciate you, Mary. It was a wonderful presentation, very educational, and I'm sure that it's something that is really going to help people understand a lot better the importance of myofascial pain treatment. Thank you.
Thanks. So myself and Dr. Hartz also will be on the call in September, and then we'll look forward to seeing everybody again for Dr. Hartz in October. And then we've got 2 more speakers in the series in November and December. Thank you, everyone. Have a great day.
Bye-bye.